Tumatamanea matipurangae Iatamanea kirunga iako imahine Manako 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 iako Maupiri iako Manako 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 iako Maupiri iako Oko yanake Maupiri iako Oko yanake Maupiri iako
Marangi nei toku Oi matae E taku ina ngaro ki a koe e maine Tō mata manea Mai te puranga E ata manea ki runga i a koe maine Manako 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 i a koe O piri i a koe Manako manako iako Mo piri iako Oe anake ianake Mo piri iako Oe anake ianake Mo piri iako
Kia ora, and welcome to our webinar. It's an honour and a privilege for me to facilitate this webinar today on behalf of Te Poutoko Ora Kiwa, Centre for Pacific and Global Health Research at the University of Auckland. My name is Dr. Karaponi Okisene Ngafa. I am Assist Director for Te Poutoko Ora Kiwa, and present with us also is Sir Conjugate Tonga, who is the Director, and some of our other assistant and co-directors, Rawai Ningshu, and also Judith McCall. My name is Dr. Karpunyuk Senaf. Like I said before, I am also head of Pacific Health at University of Auckland. And also some of you know me as an obstetrician gynecologist at Middlemore Hospital. I am of Kuki, Airani, but Manihiki. I'm also Niuean and Samoan, married with 3 children and 1 mokupuna. First of all, we're very grateful to our Father in heaven for bringing us together at this time. We're really grateful for this opportunity to be able to do this webinar. I would like to hand over to Dr. Almia Hillman, please, if she could get someone from the audience who would open us with a word of prayer. Thank you very much, Almia.
Me te ki maata kara, kia ora tātou kātou toa te aroa mātou te tua. Me ka rauka Papa Tai Richard, me te rongo mai ara koe, me ka tika na au pure tā tātou pure.
Me te ke te taute, let us pray, pure tatu i te toa. Te toa mana te tukaka me mua te reo kone mātou te ako kia te ako me te kianga. Kia koe nā aru to aroa he tō tākinga me te kore koe mātou. I te tika anga kia putu mai nā ngā te mārewa i te pōpungi, i te awa tia nei. Te pure tenei tō wairo tapu ki no mai ki roto ki mātou. Ia mātou ka i te aka aere ka rawi i tā mātou iri kāpua i te rā. Ko ki toko e te mana ko te ka uri ia, te opinga te ka rawi ia. No roto mai i te iri kāpua, te tuko tenei ki roto i tōri matapu. Nā o e ako me taki, e ako puhi mai te re tō anana i ato mātou to te tangata. Heavenly Father, we're just grateful, thankful for this opportunity that you've given us to be able to gather online this afternoon. Lord, we're here to discuss an important topic that contributes to the well-being of our iti tangata Kuki Airani here in Aotearoa as well as back home. We pray that everything that we discuss and any actions that come out of today's meeting, may you bless and glorify them according to your name and to your wishes and not to ours. We pray for all the facilitators that are presenting this afternoon, that you be with them as they share their expertise and their knowledge. We are grateful. These things we ask in your name. Amen.
Amen.
Me te ki maata
Me te ki maata tai.
Kara, if I can just introduce Tai, he's the CEO of the Cook Islands Development Agency in New Zealand and one of our partners for our forum today. Kia ora ana, Tai. Over to you, Kara.
Kia ora ana, me te ki maata Almia. Kia ora ana tai, and also some of our dignitaries that have joined us today. I'm sorry, I can't really see the name, so I'm not quite sure who's with us, but really welcome and thank you for joining us today. To everyone, welcome. Kia ora ana, and thank you so much. So the title of our webinar is Research Translation and Impact in the Cook Islands. Today's session focuses on how research can move beyond reports and publications to create real practical benefits for our people and communities and health systems. So the purpose of this webinar is to share examples of research that is being translated into action in Cook Islands context or planned research. But just before I introduce our first speaker, I just want to do some housekeeping, please. If you can keep your microphones on silent and please post your questions on the chat. Our te potoko ora kia Zoom, assistants who are also our researchers will be helping us, Nale, Lois, and Lisi. Thank you for organizing our webinar today. And please keep your cameras on so that we feel that you're really engaged with us. You may be requested to unmute when you have questions posted so that you can actually speak to your questions. And all questions will be at the end of the speaker's presentations. Thank you very much. So first of all, I would like to introduce our first speaker, Te Rāpii Merota. She is Cook Islands Public Health Professional and Senior Health Protection Officer with Te Marae Ora, Cook Islands Ministry of Health. She has extensive experience working within the Cook Islands health system, contributing to national public health initiatives and responses. Her work includes disease prevention, health protection, and community engagement, supporting both policy implementation and community-based health activities. Welcome, Te Rāpii. Thank you. Over to you.
Kia ora na tātou katoa. Good afternoon, everyone, and thank you, Dr. Kara, for that introduction. I'll be sharing, let's get started with the presentation. I'll be sharing key findings from a UNICEF-supported research, which included a community immunization survey conducted last year between August and September. The study was initiated in response to concerns raised by working mothers during a UNICEF Human-Centered Design workshop held in February 2025 here in the Cook Islands. The need for a more flexible online consent option was highlighted. To understand if communities are ready for digital consent, a human-centered design approach was applied to further explore community views, visibility, and acceptability of this online option. And to understand the issue, it is important to look at the current situation. School-based vaccination programs rely on parental consent before any vaccine can be administered. Current system is paper-based through schools. Sometimes paper forms can be lost, delayed, or not returned. Immunization is a key public health priority in the Cook Islands, helping protect children from vaccine-preventable diseases. And when consent forms are not submitted, children will miss out on important vaccinations. Next. Before creating a digital consent system, we needed to understand how acceptable and practical this approach would be for the community and from the community's perspective. This study therefore aimed to assess public opinion on digital consent, identify barriers, preferences, and trusted sources of information, inform practical improvements to consent systems, and support higher vaccination uptake. Next. So we started collecting community feedback using a hybrid survey approach, giving participants the option to respond either online or on paper. We received 82 completed responses over 2 weeks. 93% were from Rarotonga and 7% from the Pāinua, reflecting population distribution, but highlighting underrepresentation of Pāinua voices. Participation was voluntary, and 70% of respondents were female, likely reflecting mothers' strong concerns for their children's well-being and engaging in health-related surveys related to children. Most respondents identified as Cook Islands Maori, consistent with the country's indigenous majority. And the majority were aged 36 years or older, likely parents or guardians of children. High education and employment levels suggest a strong capacity to understand health information and likely digital capable, but the busy population. Next slide. Key findings on the technology access. This is another important finding. While many participants supported digital options, not everyone has equal access. Key barriers included internet reliability, concerns about privacy and data protection, confidence using digital tools, and the cost of data. 16% highlight an important access gap. These concerns are important to remind us that not all households have access or confidence with digital tools. Even in communities where digital technology is widely used, a digital divide still exists. This digital divide is likely greater in the Pāinua, meaning that any digital system must be designed with flexibility in mind. Next slide, please. When asked about community preferences, email was the most preferred method, followed by traditional paper forms. Messaging was seen as helpful, especially for reminders and notifications. These results highlight the need for a hybrid system. In terms of trust, most respondents identified health and schools as their most trusted sources of immunization information. This reinforces the importance of coordinated communication and shared responsibility between education and health. Next, please. And one important, most encouraging finding is the strong support for vaccination among respondents. Overall confidence is very high. Most respondents agree that vaccines are important for children's health and community well-being. There is also strong confidence in the safety of school-based immunization programs. Importantly, most participants feel well informed to make vaccination decisions. A small proportion of respondents were neutral or disagreed, highlighting an opportunity for ongoing education and awareness to ensure everyone feels confident in vaccination decisions. Next slide, please. Community voices. This shows community wants digital consent to be secure, confidential, flexible, and accessible for everyone, and to offer both paper and electronic options, and the hope to have this online option available in the near future. Next, please. Now, based on the findings, a staged rollout is recommended, starting with a pilot in Rarotonga, learn from that experience, and gradually extend to the Pioneer. A hybrid approach should be maintained, offering both paper and digital options, so no one is excluded. Data privacy and transparency must be guaranteed to maintain community trust. Digital platforms should be simple and accessible, supporting better uptake especially for busy families and less tech-savvy.
Rabi has muted herself.
Next, please. Digital consent offers several clear benefits as identified by the community and the survey findings. It can enable faster delivery of vaccination consent, reducing delays. By moving away from paper on systems, there are fewer lost forms, ensuring more children are reached. The process becomes easier for parents, saving time and effort. Ultimately, these improvements can support higher vaccination coverage and strong protection for the community. Next, please. In conclusion, this research highlights a strong overall support for vaccination among respondents, reinforcing the importance of continued public health efforts in this area. Most people trust communications from health authorities and schools, which also provides a strong foundation for introducing digital consent. While people are a bit cautious about digital consent, they are still open to it if done properly. The study also points to clear pathways for implementation, staged rollout, hybrid options, simple and secure platforms, and trusted communication through both schools and health services. By combining digital and traditional approaches, allows us to reach more children, keep families informed and confident, and strengthen community health and well-being. Meita ki maata.
Meita ki maata te rāping. Thank you so much for that. Yeah, really appreciate that and great work. Immunisation is very important in the Cooks and also, everywhere, including here in Aotearoa, New Zealand as well. And great research that's now going to be rolled out into practice. Thank you so much. So like I said before, we will leave the questions until the end. Is there anything else that you might want to add to Raupi just before I move on to the next speaker? And just how you found doing this research and as a result of doing the research, just very briefly.
I have nothing more to add. I'm just thank you for the opportunity to present this work to everyone. Yeah,
Thank you very much for, meitaki ma'ata. Thank you so much for joining us and really appreciate it. Now, it's my privilege now to introduce our next speaker, who is Dr. Amy Henry. She's Cook Islands academic and researcher, currently a lecturer and research fellow in the School of Nursing at Auckland University Technology, and a Health Research Council postdoctoral research fellow. Her work spans Pacific health, palliative care, and health workforce development. She has experience across academic, clinical, and community settings, and is involved in research, teaching, and supervision with a focus on culturally responsive approaches to care. Let us welcome Dr. Amy Henry. Thank you, Dr. Amy.
Kia ora, thank you, Kara, for that introduction. Kia ora tātou katoa. My name is Amy. I'm just really happy to be here to talk about my research journey with a focus on research translation and impact. So I'm a registered nurse and I teach primary and community health to the third year nursing students at AUT here in Tamaki Makaurau. Also the postdoctoral fellow that's funded by the Health Research Council of New Zealand, which senior Cook Islands researchers, Dr. Omia, who's here, and Professor Al-Shadan provide mentoring and supervision for that project, and a part of that project. I also hold a position with Manatu Hauora, the Ministry of Health, and Te Whatu Ora Health New Zealand. And I was previously a committee member on the Health and Disability Ethics Committee here in Aotearoa, and that was a role I held for about 3.5 years and just completed my extended term last year. And these are roles that, as I see it, are helpful for knowledge translation, to bridging that knowledge translation or implementation gap, and research from the community to the policy writers, and hopefully have influence and impact towards better outcomes for our people. So my research focus is palliative care. So the focus of palliative care is to improve quality of life. It's holistic, cares for the family unit, and it extends and tends to care for the spiritual, social, and physical needs of family. My research methodology is qualitative, so mostly interviews with individuals, families, or groups as well, with the purpose of developing understanding. And the research methods I've used Te Vaivai from Mama Te Moana Hodges, constructivist grounded theory, qualitative descriptive design, and more recently co-design. So my research focuses at the community level, and really to develop understanding in the beginning, and then to improve access to care, try to improve suitability of care once people have better access, looking at the quality of care, having a look at what the gaps are in the care process, and improving care outcomes. And so part of that role includes advocacy. So researchers can use data to advocate for improving care and outcomes. And also mentoring is also a part of my goals for research. So at the moment, I've been advertising for a master's student. So that is a fully funded, of course, fees funded, including a stipend. And that project will examine transnational healthcare and healthcare access and barriers within the free association framework with a specific focus on palliative care. And that topic came out of conversations with community members in the focus group meetings. And as I see it, this is one of the ways that researchers can make really good use of the data they collect from the community. So even if it was, out of scope from what we were looking for, it makes a great topic for a master's student to come along and develop their research skills and investigate an important topic that the community have identified. I've also applied for some funding as part of collaboration with Pacific researchers from Victoria and Otago. We'll be looking for another master's student for a Pacific palliative care project, so that's next year or the year after, and that is funding dependent. But over the summer, I'm also looking for 1 or 2, this will be AUT students, to complete just a 10-week small research project. So it's our summer internship that's over the summer holiday period. And this gives students a chance to just try out research. You get paid for these opportunities. And there are opportunities out there, and I really encourage anyone, young people or not so young people, to apply when these opportunities come around, because it's a great way to start if you have an interest in research. So now I'd like to talk about my research in palliative care. So my work is guided by the idea of research at the interface. So that's a concept, if you go back a slide. Thanks. A concept developed by New Zealand Māori academic Sir Mason Jury. And this framework is where I see my research sitting. So research at the interface is about understanding the needs and aspirations of the community and understanding the systems they need to navigate to access care, working towards being a bridge between those two worlds. I've spent quite a few years working as a nurse within the New Zealand healthcare system in hospital and community settings, and now as a committee member for Te Whatu Ora in the Ministry of Health. So this is the system that I feel like I know and understand. And I think through research, we have the opportunity to listen closely to communities, identify how we can improve care. So whether that's through policy development, creating new clinical models, or advocating for change. And as a nurse, I see that as my research focus. So next slide. So this is an example from my current research. It follows on from previous research from my PhD studies. And this is really just a snapshot of how I see how my research and more research in general can be community informed with a focus on solutions and impact. So myself, and soon to be Dr. Maya Pocono, and Auntie Frances Wharu have been out talking to the community about palliative care, mostly here in Tamaki. The focus was on access, barriers, and solutions. And in total, 3 meetings were held for a total of 18 community members who participated in those focus group interviews. And if we just focus on access, so the green box to the right, we can see there are 2 main access points to access palliative care. So you can see this is quite New Zealand focused. So there's 2 main access points to access palliative care: that's specialist and primary palliative care. Specialist palliative care includes hospices and specialist teams within the hospitals. And primary palliative care includes the GP clinics, the community health providers. And there's some really excellent work being done in hospice in terms of outreach. Cook Islander Marlene Tuigamala and her team run a community outreach that runs across a handful of hospices in Tamaki Makaurau. The Taimei Cancer Support Network do an amazing job at connecting Pacific peoples with cancer and their families to services and support. So on the slide, you can see that the two boxes in pink, specialist and primary healthcare. So for specialist palliative care, so from collecting some data, we know that currently around a third of hospices have a Pacific People's Policy. And while that might seem low for some context around that, some of the listed hospices in New Zealand are actually really quite small. So not all hospices have inpatient capacity, and some are more of outreach and education focused. But it's the primary palliative care. If we go back, oh no, that's the right slide. Primary palliative care providers that provide the majority of palliative care out in the community. So if we focus on primary palliative care providers, we know that it's not uncommon for palliative care to be misunderstood. And this is not just common for Cook Island communities, but for many communities, that palliative care can be misunderstood in terms of what it is and what it's not. And it might be a surprise to some that someone might meet the criteria as palliative and not know about it. And I'll talk to this point. So if we go to the next slide. So one of the issues that came up in the focus group interviews was access. And this is knowing what family members, knowing that a family member is palliative, so families can plan ahead. So that is the pink box labeled prognostic disclosure. And it's known from the wider literature that Pacific peoples report late to palliative care services. And the issues we found were a lack of communication or unclear communication informing families that their family member is palliative, understanding what this means. So this is the prognosis part. So understanding, what does this mean? What does this mean for me? What does this mean for my family? And then knowing what questions to ask, and then knowing where to access support. Language barriers as well, or differences in understanding also. So this is a potential really key time for intervention. And if we think about how the healthcare system is quite stretched at the moment, or it's often quite stretched, this is a key time to get things right, provide the right information in the right way, in the right language, and in a way that families understand. So the boxes in the green are ideas from the focus group interviews and solutions from the community. So communicating in a way that people understand, start care planning, so advanced care planning, ensure access to resources or persons who can speak Māori. So we can go to the next slide. So the green are the solutions and ideas from the community, and the pink boxes represent some of the pathways or ways that research can work towards these goals. So for example, we can create a model of care or guide for clinicians here in Aotearoa. And this is the next step of the research project, which I'll discuss briefly in the next slide. But this project also includes a budget to create some resources in Māori, including some video content. Advanced care planning was raised in the focus group interviews, and this is something that we can promote and advocate for a Māori version of the advanced care plan. So advanced care plans and guides are currently available in a number of different languages, but in New Zealand, not currently in Cook Islands Māori. So that's something we can advocate for. And this project also includes a budget to create some resources in Māori, as I mentioned before, some video content as well. And advocacy, so through policy briefings, committee roles, through speaking to clinicians, managers, policy writers, teaching our nursing students also, and publications can be useful for referring back to the research. We can go to the next slide. And this is just an overview of my work so far, so in palliative care for Cook Islands families in New Zealand. So the first step, that was part of my PhD, was to develop understanding. So this was a qualitative study, which I completed for my PhD was at Otago University. So this study was to develop understanding of palliative care. So it was, again, based in New Zealand, and included interviews with 26 Cook Islands families, persons who had experience with traditional medicine, and clinicians, so nurses, doctors, and other health professionals. And my current work is building off that understanding. It's focused more on the barriers and enablers. What is getting in the way of accessing care? Is the care suitable to meet the needs when they do access care? And thinking about how that impacts on people up and down New Zealand. There's differences between the North and South Island. And the next step is from here is to start building potential solutions or pathways to better care, to understand from the clinicians where they see the gaps in care and issues of access to care, and then work with smaller community groups to start designing a model of care for clinical practice based on the solutions put forward by the community members. So for future opportunities, so there are opportunities to build researcher capacity by including students into research projects, research funding opportunities, and for our Pacific students to be included in research through those projects, and potential for greater partnerships with community organisations and health providers and researchers, and of course making use of our nursing workforce. So the number of nurses with master's degrees are increasing, and making the use and growing the nursing workforce as well, and the nurse researcher workforce. As a final slide. So Mitaki, that's my email address there, but thank you for having me here today to talk about my research. Mitaki.
Mitaki mata, Dr. Amy, appreciate that. Yeah, thank you for that. And it's I think it's really important research as well. I'm a clinician. We have our patients that come in and no idea what their needs are when they get discharged from the hospital and the hospital system, and how that can be supported. So it's great research, important for Tāmaki Makaurau, all of New Zealand, as well as our Pacific nations as well. Yeah, and also great to see that you are also succession planning around training other researchers to come in and training students who will be the future of our, research workforce, etc., etc. So thank you very much. Do you have any final words before I introduce the next speaker, Amy? I know the Q&A, yeah.
Yeah, but just thank you for introducing me, and thank you for the invite to this forum.
Yeah, no, thank you for coming on and sharing your research with us, and also future research that you're planning and encouraging. I'll ask my question later. I attempted to ask questions earlier, but I think I better stop. Now it's my privilege now to introduce our final speaker, whom I sent all the slides so that she can have a look, so she can bring everything together, and also to talk about policy and health systems as well. Dr. Josephine Omia Herman, I know that you've told me, just tell everybody that everybody knows you, so there's no need to introduce you. So I am going to hand over to you. Thank you. Thank you for coming on and joining us today.
Look, I have quite a few slides, and I won't really draw from the other two presentations, but it really highlights some of the key things that are happening, not just in the Cook Islands, but also in New Zealand through Amy's work. And it's just fantastic having this forum to share that knowledge and experience, and hopefully grow our capacity across both countries. Now, I want to talk about injury surveillance and helmet legislation in the Cooks. It's a summary of work that's happened over the last 2 decades, in fact, in the Cook Islands. And I'm going to run through it as fast as I can, because I think trying to summarize it the overview is going to help sort of give some insights into the practicalities of research, informing and guiding the realities, and then putting it into action. So next slide, please. In the Cooks, it's a lovely paradise, and we enjoy life, and we're happy when we drive these little motorcycles, and we don't wear helmets. That was in the past. Next slide. What we do know is that road traffic injuries in the Cooks is a problem. It's been a problem for many, many years. And we know that motorbikes make up almost 70% or more of all our crashes. And it doesn't just affect our residents. We have about 17,000 Cook Islanders living in the country and about 100,000 plus visitors coming every year. So huge population numbers coming through the country. And we have the social and economic impact that we know about when families are displaced because of an injury that requires hospital level care in New Zealand, but also just the disability that sometimes impacts some of our families that are involved in crashes. Now, head injury is a big one, and I thought I'd just focus on this one with traumatic brain injuries. It's a major issue for us. And what we do know in some Cook Islands data, 2 decades ago, 75% of our motorcycle riders that died were not wearing helmets. Now, we know that from that time in 2008, there was helmet legislation that was put forward, passed through Parliament, but this was repealed because of public opposition. And I must say that you can understand when you look back at the narrative, the rhetoric, at the time, we did not have the information to actually to guide and inform the public. So our comms wasn't that flash in those days. I must say we've done better now, but we'll come to that shortly. The other thing about this was that there were major data limitations. This is not just in the Cooks, it's across the Pacific region. And that sort of has made it difficult for us to plan for the future. Next slide. And on top of that, we need to think about motorization in the Cooks. If we look at data 2024, 2025, this is recent data. You know, we have more cars, almost more cars than we do people on the island, in the Cook Islands. 60% are motorbikes, and that's probably where the issue is and the tension. We have one of the highest per capita ownerships for vehicles, and we're much higher, at least 3 times higher than the Asia Pacific average. And on top of that, nearly every household, at least 4 in 5 households in the country own at least one motorbike. So high uptake and use. And if we look at injury research in the Cook Islands, I want to talk briefly about the traffic-related injury in the Pacific Research Project, which happened 2 decades ago now. And I was fortunate to be part of this and did my PhD through this project. It was a collaboration, HRC funding from New Zealand, which I'm always grateful to, the Wellcome Trust in the UK. And this was a partnership between the University of Auckland and Fiji National University. And we involved countries from Fiji, Palau, and Samoa. Some of us will know Professor Rod Jackson, as well as Professor Sitaleki Finau and Professor Shanti Amiratunga. They were the main investigators in this project. Now, out of this project, there was a systematic review of road traffic injuries. This was part of my one of my publications. And in that, the key things we learned from that, there were only 19 studies over that period of time. Most of them were more than a decade old, but we did realize that head injuries were the common feature, the most common feature, and involving young males. And of course, 2 out of 3 deaths happened at the crash site, even before they had arrived at hospital. And so it was quite important information to sort of give us some grounding on what's happening or what has happened around research around road traffic injuries in the region. As part of the TRIP project, Fiji, the injury surveillance in hospitals system was established for a year in Fiji. I think unfortunately this injury surveillance might not be in place at the moment, but again they saw a similar finding with head injuries making up 70% of head injuries. 70% were from road traffic crashes. 2/3 again of head injury deaths occurred prior to arrival at hospital. Similar trends, and of course the association with alcohol. And then in 2016, as part of my postdoc work, we put together, established the Cook Islands Injury Surveillance And this template was based on the WHO injury surveillance guidelines, as well as the FISH database, which has been really important in providing injury data, and I'll talk to that later. Thank you. Next slide. One of the other things, of course, as much of this research was progressing, there was also an agitation. As you recall, I said 2008 we had legislation. It was pushed back by the community because there was inadequate information. For example, the people crashing back in that time were young males. So for the old ladies that had to wear their hats to, this is a really, a good story about context and understanding community needs and values. And our older women going to church were wanting to wear their hats to church on their bikes. They did not speed, and they were asking the question, why do we have to wear helmets if we're not the ones crashing? And they had a valid point. But what happened in 2015 was interesting. There was a spate of quite a run of road traffic injuries, crashes, fatalities, instant fatalities that involved several of our youth in that year. And it was during the Mai Vanui celebrations. I happened to be in the country at the time with my postdoc studies, and we managed to pull together the Road Safety Summit, the first for the Cook Islands. And out of that came the Road Safety Strategy, which was an important document to sort of ground us and provide the foundation work platform for us to sort of progress road safety. It wasn't to say that nothing was happening before. There was a lot of noise around road safety, but just trying to organize and coordinate the country as a whole was difficult. And of course, our goal was zero road crash fatalities. And if I may acknowledge, the Road Safety Steering Committee was made up of the Road Safety Council, police, health, education, Religious Advisory Council, Aronga Mana, community leaders. So, a whole of country effort. Next slide. And if you look now, just fast track forward, if you look at our journey of helmet legislation in the Cook Islands, because of course the focus was on helmets because of the overwhelming overrepresentation of motorbike injuries, head injuries, and fatalities. In 2008, you can see the initial mandate, and that was pushed back and repealed. And then in 2016, a sort of midway targeted approach was put forward, restricting the ages to 16 to 25 years. And this was really to capture those that were most impacted by road traffic crashes and injuries and fatalities. And then come 2020, which was really a progressive action. We went straight for universal compulsory helmets for every rider, regardless. And I think it's a testimony of positioning that has put us into this space. And I do think that this has been an important policy for the Cook Islands. And you can see our two ladies, just take us back. One slide. Two ladies now, they have their helmets and still happy and enjoying. Next slide. Thank you. So, what really made this happen? It was a collective effort, early support, initial impact, endorsement, police and the community, right time, right measure. Sometimes it's all about timing, and of course the reception, and sort of understanding, what was really, it was about making sure the community was heard. And you can see here, I just want to reflect on Liz Ido, our previous Secretary of Health, with her helmet and the flowers on it, promoting, this was the 2016 time, and of course the police getting ready to implement helmet laws in the Cook Islands. Next slide. Now, one of the things though around helmets, we know this as well, and learnings from all of this, what works in this another country does not necessarily work in ours. You can see in other parts of the world where motorcycles or motorbikes, are frequently used, Vietnam and other countries, they have helmets all the way through. But for us, it was more about timing, about what was acceptable to our communities and what we could enforce at the same time. And of course, balancing that with public safety. On one hand, public health doctors and doctors and nurses in the hospitals were just saying, please, can we stop this? We don't like watching our young people pass away at such a young age. But I think there was also the need for political courage, the data-driven arguments, the information that we were able to provide became more sophisticated in terms of presenting the argument for this, and of course, advocacy across the country as well. And I always think about this, the importance of engaging and empowering our community. You know, when everything is community-based, it's more likely to be sustainable. We need patience, we need respect for the consultation process. And I do believe that as much as sometimes we cringe and think, oh, this took so long to get across the line, we got there. And the main thing now is making sure that it's effective and impactful. Next slide. And so I just want to put forward here what's happening with the Cook Islands Injury Surveillance System. This is the table of contents, just a sort of a snippet of the contents in the Te Maraiora National Health Information Bulletin. This is the 2024 one that was published last year, and the 2025 is being published shortly. But it highlights the Cook Islands injury surveillance. I'm so proud of this country. I don't know if any other country in the Pacific is also publishing these results, but or whether they have an injury surveillance system. But I think for the Cooks, we should be proud about this. It talks about the road crashes, admissions, hospital admissions, but what's important here is falls as well. Something that we did not pick up before, as well as violence. These are important public health topics that really impact our families in a negative way when we don't address them appropriately. So I've got a few slides remaining. If we can see the next slide, just to give you some idea of the slides. And if I may acknowledge the TMO staff, Abigail and your team, Maina, for the fantastic work you do. So this is really a snapshot of 2024, drowning, burns, cuts, violence, falls, road crashes. As much as road crashes take the burden of, you know, of the injuries in the Cooks, at least now we are able to capture other important injuries, and all of this together helps us, you know, put together better preventative programs to mitigate these risks. Next slide. And look at the number of road crashes. As much as we would like to, you know, have those numbers lower, you know, hopefully in time, as we continue to monitor, as we continue to use this data to inform our preventative actions, hopefully we'll see these numbers reduce lower and lower. Of course, there's more information we'd need to understand better who's crashing, where are they crashing, are there roads that might not be so good, are we driving on motorcycles that have poor warrant fitness, for example, or is alcohol still an issue? Next slide. And so here you can see in terms of the transport crashes, and this goes back to 2017, and at the same time you can see the involvement of alcohol. So, you know, I think, you know, if there's any take-home message, it's really in 2024 where 33% of crashes involved alcohol. And I do know that our police are quite strong on the roads in terms of breathalyzer testing for alcohol. And I think that's just fantastic in terms of what we're doing here in the Cooks. I do know, though, we do need to think about other drugs and recreational drugs that might be also impairing drivers. Next slide. And of course, we look here in terms of the alcohol-related road crashes. We see our 15 to 24-year-olds most impacted. Pay attention to the 2024 line, which is in green, and you can see the numbers flattening out. And the 45 to 54-year-olds actually have a higher number compared to the younger people. Now, just remember these graphs, they are numbers. Ideally, we would like to age standardize so that we can get a better reflection of who's actually being involved. As we know, there's more of a younger population in the Cooks. So those are some of the things we can look at in terms of our health bulletin. Next slide. And here, just highlighting the falls that would be on your left in the yellowish columns. And you can see that we do have a considerable number of people having falls. We would want to know who's falling. Is it our older folk? And if you jump across to the other one, you can see it's our older people aged 55 years and above. This is a population that we don't always give enough attention to in terms of frailty, in terms of older folk that fall and break their hips. And so, you know, both of these ends, as well as our younger kids, are so important to understand better why they're falling. Why are the babies falling? Are they falling off cars or trucks, falling off trees? So, you know, this is where injury prevention and mitigation comes in play. Last slide, I think, one more slide. And I just wanted to highlight the incidence of violence by type. I think this is one that we would like to mitigate or address better. We don't have trend data here, but it would be important to follow that through, including child abuse and sexual violence. These are important indicators to give us an idea about some of the threats that exist in our communities and ways we can draw on our communities to help us address them in a culturally appropriate manner. Last slide, I think. And there we go. Just want to acknowledge our National Road Safety Council. They've always been strong advocates for this work. Our government, our Rongamana, our Religious Advisory Council, the three pillars of this country, the people of the Cook Islands and Te Marae Ora. Just grateful to be part of this work. Me taki maata, kia ora.
Me taki maata. Thank you very much, Almir, for that. Congratulations, Almir, you know, that journey and seeing it right through and make a difference, and that very impactful as a young researcher and still continuing and advocating to improve outcomes for our communities in the Cooks. Me take maata. I think there's quite a few questions on the chat, so I'm just hoping that the guys, my Te Pūtoko Ora Akiwa researchers who've been helping would help with the questions, please. But I know that there was Cam Young was the first one. This was for Dr. Amy. Do you have any insights to that? What palliative care services are available in the Cook Islands or other island nations? Is there a need for palliative care here? I think that was the first question that came through. Over to you, Dr. Amy.
Thanks for the question, Kia ora, Cam. Nice to hear from you. So my research has really focused on New Zealand, Aotearoa, but it would be really interesting to know and collect some information about the Cook Islands. But I think from my perspective, having worked in the New Zealand system, and that's a system that I understand, and I think what Dr. Omea just mentioned before around community context is really important. So I think having someone who really understands the Cook Islands context, the context of the different islands and the health system would be, a great person to lead that research. And I'd definitely be keen to support anyone who wanted to undertake that research so we could understand, better what is available and what not's available and what that looks like, from a family perspective. Thanks, Cameron.
Cameron, was there anything else that you wanted to add to that question? If you wanted to unmute, if you're still here.
Kia ora, thank you very much, Amy, and thank you, Dr. Kara. That was all, but I look forward, Amy, to your next research study back in Raro in the homeland. Kia ora, everyone. Mei taki.
Mei taki, Cameron. I think following from that is a question from Shanti. Amy, that you noted that only a third of hospices had a formal Pacific engagement policy, and this may be due to a small size of several hospices. That you'd hope that palliative care clinical organizations have a formal policy applicable to the sector in general. Have you had any engagement with such professional groups? Shanti, if there's anything else you'd like to add, but over to you, Amy.
Nothing more to add. Kara, sorry, I can't put the webcam on. I'm in a clinical space, but Amy, it was a fantastic presentation. And I just thought that it is sad that only a third, regardless of size, had that policy when it is such an important issue. And I'm just hoping professional organizations are more responsive than to possibly hide behind that excuse. I'm not sure that they're offering that excuse, but it'd be great to hear what connections you might have already got with clinical people. Thanks, Amy.
Kia ora. Yeah, thanks for that question. So that came about from small piece of research and just contacting every hospice in New Zealand, big or small, and trying to find out what information they had in terms of policy or any type of clinically guiding policy documents or guidelines. So that's how we found out about that information. And then when we mapped it across the Pacific population, so the hospices that do treat a larger portion of Pacific persons, so here in Auckland, they all tended to have those policy documents. It was really the smaller, so for instance, the West Coast and places like that, where there's much smaller Pacific population. So that was one good thing that came out of it. But I think also, when you carry out this information, it does make people think about it. In terms of what perhaps the missing, and there's some hospices who worked together to try and produce some better policy documents. But I agree, it'd be nice to see that all hospice organisations had some type of policy document or some guidelines of how they are to reach out to Pacific communities, no matter where they are in New Zealand. Yep, so absolutely.
Thank you, Amy. Really important work. Keep on going.
Absolutely very important work, Amy, and keep on going. Amy, just out of that, my question is, the researchers and the funding that you have for the researchers, would there be an opportunity for those who are in Te Marae Ora or researchers or from the Cook Islands to be part of your research? Would they be funded to be part of it, so that, increase research knowledge, etc., on the island? Oh, to Amy.
Yeah, I think that would be a great pathway forward to have those collaborations. And I think that's one thing I mentioned, to have those collaborations. As a registered nurse myself, I'm always keen also to work with other nurses who are working in health to carry out research projects that are close to them as well. So I think that would be a great pathway forward. Absolutely.
It would be great to have some researchers from the islands come over, I suppose, and do some research here in Tamaki Makaurau, AUT. I think the third question is from Potereapi from Nukutau Pokura. I'm a keen Ghana. Sorry, Nukutau, do you want to unmute and ask your question, please? If you're able to.
Yeah, sure. Kia ora, and thank you. Kia ora, I was just keen on the behind the scenes. So I know that there's a small pool of TMO staff that have been involved in research from all stages. And I was just wondering how the current status is with staff conducting research in regards to the skills and development that is produced after doing a research and stuff, and how that looks like for TMO at the moment, if she had a view on that.
Yeah, I think the question was for you.
In terms of the research, I think there is opportunity, especially with with the trainings now happening with the TMO, the TMO staff with the bachelor's training happening in country, and staff are enrolled in these trainings and bringing the training in country. I think that's a big improvements in terms of marae or providing this training in country for our staff, and especially in this area of research, and encouraging staff to take research, and also looking for future fund in the future to support this area. And there's quite a few research that's been done by the health protection units, especially around mosquito surveillance with PECMOSI. I think that's capacity building for our staff, and with this training, we're looking forward to more research to be conducted by the staff, by TMO here in the Cook Islands. I think that's.
Thank you,
Does that answer your
Teriapi.
question, Nuku?
Nukutau, does that answer your question? I think your question was around how can you extend the knowledge, is that correct, to other areas around research and to be able to carry out research? Is that the
Yes and no.
in your section as well? I'm not quite sure where you actually work, but
I'm studying here in New Zealand. I used to work at TMO, and in the past, opportunities for research usually meant TMO staff were just the data collectors. We weren't part of the creation of the research, whether it would be qualitative or quantitative. We weren't usually part. We had maybe some people involved in the analysis of the data. But that was it. It was usually limited to those skills. So I was just wondering if that has changed at the TMO side of things now. That's where my question is based, on the TMO staff skills and development.
Mia, you might be able to answer that question as well.
I actually had a different angle to it in terms of the work that API has done. Are there conversations with Stats New Zealand, with Cook Island Stats, in terms of our next census, whether we should do hybrid, paper/digital? Have we thought about that? If we're thinking hybrid for consent, potentially like what we've done in New Zealand, which is not that flash. Digital is not that flash for everybody, but it might work for the cooks. Has anyone had that conversation? Or are we still paper-based?
I think that's for you, Teriapi. Is that right, Omia? Your question is for Teriapi.
Well, this research was actually to inform policy, and it's guidance. If we needed to do something online or paper, at least we know from this research what we should be doing. But at the same time, it is also important from this finding that in any future public health or TMO services regarding for our families, we need to combine the digital and paper options. So those who are not tech savvy or have access difficulties on internet can be included in the service, if there is a plan to use the digital, modernize our service way forward. Is that what?
Thank you, Terea. Was it someone that was trying to ask a question? Just to go back to Nukutau, this question earlier, Nukutau, maybe that's why you will be returning back to the Cook Islands and just improving research so that it's conducted, I suppose, by Kuki Airani people from the outset, applying for funding, setting up the research that is important for the community, and working with the community together, and publications as well as authors, rather than researchers coming in and getting the data and then coming out again. Something that you might look forward to in the future. Hopefully, Nukuto. Got a thumbs up there. Anyway, I better come back to the questions. So Tide
Tara?
Richard. Yeah, sorry.
Tara, may I just respond again to Api's question? Nuku's question to Api.
Yeah.
I sort of missed the point with the other one about the census, but my thoughts about this, she's asked a very important question around not just about data collection, but data analysis. And we know that some of these skill sets are not necessarily available in country, but we have, through this forum, I do believe we will be able to grow that capacity, sharing knowledge across countries. And that is one of probably the biggest things that we will benefit from in the Cook Islands, where some of our, what's his name? Oh gosh, he was in the last webinar. It's just slipped my mind. But he has one of Arunangari's daughter.
Puni? Oh no,
No.
somebody else. Sorry.
He's supervising Arunangari's daughter. She's in stats. And I do think that there's a level of analysis, data analysis, that we need to build in country as well as outside. And if we don't have it in country, we bring it in through sharing. But of course, making sure data sovereignty and all of those other things and ethics are covered nicely. So I think the short answer is we can build that capacity in country, but it's going to take a while. And if we need it on speed dial, then we do need to use this forum to bring in our New Zealand-based or overseas-based capacity to help. That would be one way to fast-track the Cook Islands work. Thank you.
Thank you. So this is I'm sort of
Tara, so
lost here
Colin
with
has
the
his hand up.
Oh,
Tara?
sorry, Colin. Sorry, Colin,
Oh,
over to you. I'm trying to go through the questions while you can, yeah.
No, it's just on that point about that analysis. Firstly, all three of you, fantastic, wonderful presentations. The next Cook Island webinar is actually on data analysis in June. And we have a number of people lined up. One of those folk is Jesse Kokawa, who's a biostats person. So just for the people on the call today, the next session is on data analysis, but I also just wanted to say well done to the three of the presenters today. Thank you.
Thank you. Nale, can you please just I'm trying to follow the many questions. There was one from Stephanie Bolo. Hi, Dr. Amy, from your research, what do you see as the biggest gap between what families need in the community and what the current health system is able to provide? And thank you, Colin, for that.
Kia ora, thank you for your question. So I think, focused on access today, and I think that is it's definitely a gap. We know from previous research on Pacific peoples as a group that has been an issue for some time now, and from the recent community interviews as well, the focus group interviews, that remains an issue for people, just that initial access. So that's kind of knowing what to do, where to go, and it may be some small things as well. So making sure that they're getting referred to palliative care services, and for some families that might open the door up to other access to equipment, medications, some of those simple things that make it much easier to care for someone in the house that are available in New Zealand, and that some families aren't receiving currently. So yeah, it is some of those essential things that you need to make caring easier. And then financial as well can be very difficult here in New Zealand in terms of making sure you have someone who's available to provide that care. Kia ora.
Thank you. I think there was a question for you, Dr. Omia. Do you think that if research also shows that crashes were due to conditions of the roads, would that potentially highlight resource allocations to fixing roads, consistency around the islands? What, if any, do you see improvements around the culture of alcohol drink driving that is aimed at both tourists and locals?
I think I'll go with the easier one around roads. With roads, we do know that there are some black spots on the island, and we use, I don't know if it's still done now, but GIS mapping is supposed to show us where the more frequent crashes are occurring. It's a small island, and we're not looking at major, thousands of crashes every year. But this information hopefully is being analyzed by not just police and infrastructure, but also by Te Maraiora to guide the roads. We know in all low middle income countries, even though we're high income now, that we still have issues with roadworks and maintenance and so forth. So one of those things, just drive slowly. Bikes are quite hazardous, but they're nice to drive, aren't they? Everybody enjoys the fresh air, but that's the thing. There's a risk with every bike ride you take. When it comes to alcohol, I think I just wonder whether this is a big question for the country as a whole. Similar to how we addressed helmets, we need to talk about this one. I'm not familiar with what's happening with enforcement, with those that are caught drink driving, what the penalties are, because if they are, not sufficient as a deterrent, then of course it's going to continue. But the alcohol culture is quite strong in the cooks, and something that we need to think about going forward. I don't have the answers today. Thank you.
I also see that there was also a question around why numbers are not declining as much as we expect, noting declining population. Whether it's the influence of alcohol in driving, or is it just societal norms and enforcement, that maybe enforcement is not adequate?
What I'd want to do is have a closer look at the data. And that's the thing, when you set up an injury surveillance system, any system, in fact, screening program, you should be doing quality audits and checking that the data is valid. I haven't done this, and I'll meet up with Abigail and the team tomorrow and see if we can have a look at that. We do need to look behind the numbers to see what's actually going on and understand more about where we should be putting our attention. But yeah, it's one of those things. But we already see from the data, just crude data, alcohol, almost 50%, 30 to 50% is alcohol associated. So those trends have not changed over time, which is a big worry for us. So there's a societal culture that we need to think about going forward. But I think this is going to take the whole country to sort out. It will be too hard for Te Maraiora to take on their own. Thank you.
And have you had any thoughts around the culture of alcohol, Omia? I mean, I know that there's a lot of tourists that come in, as well as a lot of our young people. Yeah, I'm not sure.
Yeah,
It's
look,
tricky.
the tourists come for a good holiday, and of course, alcohol is part of that culture, as it is in New Zealand. I think enforcement in New Zealand is a bit more tighter than it is here. I don't know whether the addressing alcohol really is about the whole of system, where we look at the impact of alcohol on your liver, on your heart, on your overall well-being. Because I think that's the bigger worry for us with cardiovascular disease and obesity, and you combine smoking and alcohol and vaping, and we're in big trouble in the cooks. So I wonder whether that's the way we can address this. Of course, we know we can tax alcohol. I think alcohol is too cheap. Hopefully no one will get angry with me, but I think alcohol could be taxed better. I mean, you look at French Polynesia, it's so expensive to buy alcohol there, and I'm not sure why we haven't done that here.
Thank you for that. I know that there's been some other questions as well. Yeah, and there was one from Nuputau again around key to hear your POV. I don't know what the POV stands for, on what situation looks like a decade from on the
Point of view.
legislation, advocacy, promotion of behavior change push
Yeah.
in 2015.
I actually think we have done very well in terms of establishing policy, establishing surveillance. These are key platforms to guide us going into the future. You know, no data, invisible. We don't really know where we're going, where's our waka going, but at least we have a fair idea. I do think, though, that we need more scrutiny on the data that we're collecting. We need to check that it's complete. That's always the biggest worry for me, that we're missing on reporting, and also trying to check really. Yeah, I think that's the main one for us. We didn't have this years ago. We had anecdotal information that this was happening. Now, for the last 10, 15 years, we have good, robust data that still needs quality verification and so forth, or validation. But on top of that, we have legislation that has been informed, even by the, you know, with data that wasn't that flash in some ways, but common sense prevailed, and we have legislation in place. You know, no one's talking about seatbelts in cars, and the reason being that hardly any people crash in cars, and yet we know in other countries seatbelts are a standard. So, you know, it's really trying to understand the context that we live in the Cooks, and what will work, and, you know, what's going to make the biggest impact for the money and resources we have.
Thank you, Umia. I think there was one question from Ta'i before he left. And he was talking about CIDANZ. And he was saying about MEL framework. Looks applicable to the work that we do, especially for Tato Whānau O navigators. And he said he's keen to hear some practical tips from your expert researchers, if any. And he's delighted by the critical anga and look forward to the next session. There's one more from, is it Rebecca George Korteka? Do we need to address the affordability of alcohol? How do we stay on top of the data? You mentioned scrutinizing data. What would you suggest needs to be put in place to support this work? Thank you for your amazing research and service.
Thank you, Rebecca. I think in terms of the affordability of alcohol, again, I do think that we possibly could raise the prices more. Given our income that we earn here, we know that this works for those that can least afford alcohol. And the impact of alcohol, especially in road traffic injuries on the country, I think we have not done another review on the impact on not just the social, but the economic costs to the country. The health system is overburdened when you have all of these, you know, road traffic crashes with alcohol involved. And a lot of that is with driver impairment. So I do think the affordability of alcohol is a good question to raise with our people. How it's going to happen, I'm not too sure yet. I think this is one that Te Maraiora might have to think about in raising, and I'm happy to support, of course. In terms of staying on top of data, I think this is one thing. Sometimes it's easy for us to come into the country and say da, when in fact we need to also sit outside the country and help. I've always been clear on that. You know, if we're going to help the Cooks, then help, rather than just talking all the time. So I think that one would be something that we can do, and we have AI now that can help us with all of these, especially with the fact that we use medtech in the Cooks, and we have that kind of system for patient information management systems in New Zealand. So I think there's some options for us. And so thank you, Lissy, for giving the name of the guy, Professor Andrew Spall. He's going to be important, I think, going forward. There's others like Palliative, there's Shanti Amiritunga that can help us, in my view, put together something that would be helpful for Te Maraiora to consider taking forward to the public.
Thank you, Umia. And I am very conscious of the time. We have 5 more minutes. I'd like to say thank you very much for everyone who has joined us today. Thank you for those who've set up our webinar. Thank you for our speakers, for Te Reapi'i, for Amy, and also for you, Omia. Te Reapi'i, thank you for the work that you do around immunization, how you've done this research, you have very important findings around it, around, confidentiality, the trust of the community, and also about hybrid. Not everybody has access to digital technology, and there needs to be a hybrid system that is important for the country to be able to get the data collected adequately. Also, Amy, thank you for the work that you do on palliative care. I think it's really, really important for our communities. It's work that we've been very aware of, but we haven't, this is the first time I realized that the work that you're doing is really important, not just here for Aotearoa New Zealand, but especially for our Pacific countries as well. And Omia, you and I go a very long way, and we've come through as researchers, I remember, as registrars in ONG, and then you went off to public health. Thank you for all the work that you do. That's really important for our Director, Sir Colin Tukitunga, and also our team. Ete Potoko Ora Kiwa, and everyone that has joined us today. We're so grateful. I think there was one question from someone around access to the slides. Please email us or to Lisi Malia Pereira, and then we will let you know. We'll probably PDF as long as the presenters are happy to have their slides shared with everyone. Mia, I'm just gonna Sir Colin, did you have any final words?
I guess the symbolism of this, the people talking about stuff, but this is 3 Cook Island presenters taking the lead, presenting elegant, simple, practical pieces of research that mean a change to practice. That's, I think, fantastic. All 3 of them should be congratulated. Those who are listening in who think they have something to share, there'll be other opportunities. Just in terms of Potoko, we're happy to help, but in a way, there's plenty of partners in this now, and you could drive this one yourselves. For this, the Cook Island webinars, I thank Lisi Malia for her patience and organizing speakers who drop out and so on. So I think it's been a wonderful session. We can have this notion that research is a big, elusive, mysterious thing that only a few people can do. But as you see, Terepai, Amy, and Aumea have shared very practical studies that they've done, and I hope that this will continue. Sorry, just want to say thank you, and wonderful, all 3 of you, and to everyone, of course, for joining us today, and Kara for your gentle facilitation. Thank you very much, everyone.
Yeah, thank you. Jude, what other tipu tuku did you have?
Kia ora ana, and I just echo Colin's comments. What a fantastic afternoon. I think the word that comes to mind was elegance. I think these were 3 really beautifully elegant pieces of work, really distinctive, but a reminder of the importance of really clear presentation, using thoughtful study design, and really communicating and translating those results into practical ways. So I just commend all the speakers. I think Lisi Malia and the team for organising, and you, Kara, really lovely facilitation style, really welcoming and inclusive. Mitaki.
I'm not sure if Rowena is here with us today, but I don't think she might not be. But thank you very much again. Omia, I'm just going to ask if you know anyone of the audience, please, who would like to close with a word of prayer. But I'd like to say thank you very much, everyone. I hope that, we're here to support and work together with all of you. And thank you. Me taki maata.
Thank you, Kara. If we can ask Api, I know she just presented today, but it would be nice if Api from Public Health can close us in a prayer. Api?
Thank you very much, Api. And hi to everyone in the cooks.
Pure tātou ta openga tā tātou website te ara tō mātou mitua i te ao wa te mātou ki te openga o tā mātou iri kāpua i te Airani me taki maata no te oronga mai te ao manako tuke te riro i te akametaki i tō mātou kopu tangata, tō mātou itis tangata i roto i te Kuki Airani e te paenoi wao, no runga i te au api eri, ti rauka mai no te akametaki anga i te oranga o te Palliative. Me taki maata te atua no te tika anga, ti eri me mātou no te tika e te ora i te manako mānea ki runga i te mārewa e te atua. Kia no mai rā koe, ki roto pua i a mātou, tauturu maenga i a mātou i te kimi o onua ko o te anga i te au marama, te kārauka no te tauturu i tō mātou i te tangata i te atua. Ke mātou ka oki ki tō mātou mutu are, na aura i a teki mai a mātou i te ora, e te wātu ki te taira o e te atua tumai nei. Kia ora mātou i a koe, ma te meta ki e te au e te atua. Nā rota e Yesu Mesia, i puri atu e mātou i te ia mea rawarai. Āmene.
Āmene. Me itaki maata, Api, for the pure.
Api,
Thank you, everyone. God bless you all. Ka kite.